Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. Hey, so I've done some episodes previously on specific masturbation questions for female anatomy and male anatomy. And you can look through my archives to find those. But this one is, I've gotten many more masturbation questions. And so this is a collection of all types of anatomy and some random masturbation questions. Okay, question number 1. How do girls masturbate? That's going to be different. We're talking about male anatomy. The main source of pleasure for masturbation is going to be the clitoris. The clitoris is the very sensitive mound that is where the inner labia or the labia minora meet up, so the inner lips of the vulva or the vaginal area. So it's going to be toward the front of the private area, right below kind of the pubic mound, the mons pubis. A lot of folks, when they're first starting out, assume it's got to be the vagina. And they try masturbation with inserting things into the vagina or fingers, and the fact is that it's actually a minority of females that orgasm with vaginal penetration. It's usually the clitoris, or at least some clitoral stimulation. So the way many females masturbate is going to be stimulating the clitoris, and that can be with a finger, that can be with a vibrator. So experiment and see what feels good to you, but don't go straight for the vagina. You can if you want to, but experiment with the other areas as well, because it's usually the clitoris. And this information goes for anybody who wants to please a female as well. Go for the clitoris. Okay. Question number 2. I think I'm addicted to porn. I need to watch it every few hours, and I don't know how to stop. What can I do? Thank you for asking this question. So I have certainly talked about porn and how it is fantasy, but can be used for a turn-on stimulus. There are people who do get addicted to porn, and it sounds like you might be one of those individuals. So porn addiction, we're just really now getting to be more comfortable with addressing it as a society. Many schools of thought are treating porn addiction like any other addiction, like alcohol or drugs, in that it triggers that same sort of cycle of I need to get this fix and I can't stop. So we don't have great treatment for porn addiction. What I would recommend is, if you can talk to your doctor about it, that would be great. But I would also encourage you to check out online communities like NoFap. So this is an online group that the members have experienced addiction to porn and masturbation, and it's a community where they support one another in stopping. Finding a community of support is generally, for any type of addiction, going to be a very important part of success in overcoming that addiction. So I would encourage you to try to find a community. And that would be where I would start. Check out NoFap for sure, and if you're willing to talk to your doctor about it too, that's okay. Ultimately, don't panic. It'll be okay. But find others who have experienced similar concerns. Question number 3. What's the proper way for a guy to masturbate? Okay, so there's no proper way, and I've honestly gotten this question a lot. But the general way for a male to masturbate is obviously stroking the penis until the point of orgasm. Technique is going to vary depending on if you're circumcised or not, or kind of what feels good. Generally speaking, the most sensitive parts of the penis are going to be around the head or the glands, as well as on the underside of the penis. And testicles can also feel good too, so don't forget to play around down there if you want to. But if you are experiencing a little pain or skin catching with masturbation, use some lube. Lube is good in sort of making that skin to skin friction more comfortable. Question number 4. What can I do if my foreskin will pull back when not erect, but won't pull back when erect? So what I suspect is happening is that the penis is going to be thinner when it's not erect, and it thickens up with blood when it is erect. And so this would be potentially just a mild phimosis issue. If you are able to clean the penis when it's not erect or flaccid, you can pull the foreskin back, clean it, put the foreskin back up, and then if you have painless intercourse, it's not that big of a deal. But if your erections are painful because of your tight foreskin, then you should talk to a doctor about phimosis. They can prescribe a steroid for you to put on the skin to kind of stretch things out, or you can try doing some gentle stretches on your own. But I would say if it's painless, don't worry too much about it. If it's painful, definitely worth talking to a doctor about. And last question. Can you curve your penis from too much masturbation? No. With the exception of if you do other things that cause scarring of the penis, like if you were to use more rough techniques with masturbation. Some people find that using toys with masturbation feels good, but sometimes those toys can actually cause damage to the penis. And so I would say, to answer your question, generally, basic masturbation, no, does not cause your penis to curve. What does cause your penis to curve is scarring. Be gentle to your penis when you're masturbating. Okay. That's my round of masturbation questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.